Hello, good afternoon from the World Health Organization headquarters in Geneva. My name is Alexandra Kuzmanovic, and given the recent news about new variants of COVID-19 virus, today we'll have experts who will tell us more about the ongoing research in this regard. My great pleasure is to introduce Frank Honings, who is WHO Senior Laboratory Expert. Hello, Frank. Thank you for joining us from Cairo today.
Hello, Alex, and thank you for having me again.
Thank you. And we are very pleased that we have two scientists, two guests from the UK joining us today. We have Jeffrey Barrett, who is the lead scientist at Wellcome Sanger Institute, who is actually director of the COVID-19 Genomics Initiative. Hello, Jeffrey. Thank you for joining us today.
Hi there. Thanks very much for having me.
Thank you. And Judy Brewer, who is a virology professor at UCL and who is also a part of COVID-19 Genomics UK Consortium. Hello, Judy. Thank you for being with us today.
Hello. Thank you for having me.
Thank you so much. Before we start going into questions and talking about this very, very hot issue those days in the COVID-19 response, I would please ask you to tell our viewers more about your work, about your background, and of course, what has been your role in COVID-19 response. Judy, would you like to start?
Okay, well, I'm a professor of virology and also a clinician who works at Great Ormond Street. And I've been using genomics for many years to look at pathogen transmission in hospitals and to look at how we can apply pathogen genomics in public health and in diagnostics. And I was asked by Sharon Peacock, who is director of COG UK, to come together at the very beginning to suggest people who might be suitable and to help to set up the COG UK consortium. So I've been in from the beginning, and I've been helping to do the genomics and been helping with the steering committee. And I also have run a study within COG UK, which is called the Hospital Onset COVID Infection Study, which is specifically looking at how we can use genomics to track the virus in hospitals.
Thank you so much, Judy. That's a lot of work and experience that you're bringing to this response. Thank you for being with us. Jeffrey, would you like to tell more about yourself, your work, and role in the response to our viewers, please?
Sure, thanks. So I worked as an academic in human genetics, in fact, for about 10 years at the Wellcome Sanger Institute, which is a genome research center near Cambridge in the UK. I actually, more recently, for a few years, worked in industry as the chief scientific officer of a startup company called Genomics PLC. And then this summer, I decided, so my background is in the sort of statistics and big data analysis of genome data sets. And in the summer, I decided I really wanted to make a contribution to the pandemic response. So I returned to the Sanger Institute to help lead the analysis of many thousands of virus genomes that we sequence as part of the COVID-19 Genomics UK project.
Thank you so much, Jeffrey. And last but not least, Frank, I know our viewers have seen you already, you answered their questions a few times during this response, but maybe we should remind them of your work and experience as well.
Yeah, thank you, Alex. I'm trained as a virologist. That's a scientist who studies viruses in the lab. I've spent many years in the field, Africa, Asia, now the Middle East, and I've been with WHO for almost 10 years. In terms of COVID-19, I'm part of the WHO headquarters team that manages the pandemic, specifically the technical team, and within that technical team, we focus also on laboratories and testing. One of the areas that I'm responsible for is the work on COVID-19 evolution, how viruses change over time and what that means for public health. As such, I'm also closely involved on the work that's being done on all the different variants.
Thank you so much, Frank. And before we go to our guests and more questions, I will maybe ask you to give global overview to our viewers on those different virus variants that we have been informed lately, but also before that, and how viruses change, not just COVID-19, just for us to understand a little bit better what has happened.
Okay. So perhaps what I'll do first is I'll start talking about how we monitor the different viruses that are circulating. And then I'll go into a little bit more detail about how these viruses change. So in terms of the monitoring of the different viruses, it depends really on the kind of country you're looking at. Like some countries like the UK have very comprehensive and nationwide setup to monitor the different viruses that are circulating. And they do this using a laboratory method called sequencing. Sequencing really is a technique that allows you to take a closer look at the genetic composition of the virus. So really the recipe, all the letters that make it up, the virus to make it function. The sequencing really is a very neat tool, and it allows us to group the different viruses and also find out more about the changes and mutations when you start comparing those different sequences. So mostly we're looking at whole genome sequencing. So that's a difficult term, but whole genome sequencing means that you really read all the letters of this virus. So the whole virus, the whole genome, all 30,000 letters. And this whole genome sequencing for SARS-CoV-2 is around 30,000 letters. And once you have these letters, these sequences, they can be analyzed and compared using computer programs. The sequencing actually technique is quite complex, requires a lot of trained staff, especially if you want to sequence many viruses. And as you can imagine, aside from just producing the sequences itself, there's a whole data interpretation part, like really to make sense of all these sequences, all these letters, and we call that bioinformatics. It's very complex and requires powerful computers and a lot of storage space and so on. For countries that actually do not have this kind of advanced setup, it's really important that they look at different signals that may come up, signals that are unusual, anything that stands out and gives us a hint that the virus is changing. And then we can take a subset of these samples of these viruses and start sequencing them and compare them to others that are circulating. So that's the different differences between the countries as we are monitoring these viruses. So as this is a global crisis, it's really important that we get as many sequences as possible from as many countries as possible to really get a good picture of the global pandemic. So these viruses have been sequenced and shared internationally. And what's happening so far is that close to 250,000 sequences have already been produced and shared. And I think that's really impressive. If you look, now that we have these sequences, there are different expert groups looking to make sense of all these sequences and these changes and what it all means. So one of these working groups is the WHO Virus Evolution Working Group. And they've also looked into all the different variants that we hear about all the time. You may have heard about this very common D614G variant. It means basically at location 614 in the recipe of the virus, the D has been changed to a G. So that's when people talk about D614G, it means like from a location and then what it changed into. For example, also the working groups have been looking on this variant under investigation in the UK, which was the topic of today's discussion. But it's not only the UK. We find these variants in different shapes and forms in other places as well. Take, for example, South Africa, and that has recently announced 501v2. So that's a variant with a change at position 501. And just recently, there was an announcement also by the UK that this similar virus was also detected there as well. Two variants with a 501 mutation. The fact that they're detected obviously doesn't mean that they're immediately spreading within the country, but it does mean that the mechanisms that we have in place are working. And that's really important, that these sequences are constantly monitored. So, but more investigation is needed. And we've also worked very closely with the SARS-CoV-2 variants that are associated with animals, like, for example, the mink-associated variants that we talked about and saw a couple of weeks ago in Denmark. So, Alex, would you like me to go into mutations as well?
Maybe we can move to Jeffrey at the moment, and we can come back into details. So, Frank, you mentioned that we know, the whole world knows, that a new variant has been identified in the UK a few days ago. Jeffrey, you were part of the team who has identified this new variant. Can you please tell us more? How did you discover it, and what concerns have been raised by this new discovery?
Sure. So that's right. I'm part of the team, as well as Judy is as well, of this UK COVID-19 Genomics Consortium. And we set up very early in the pandemic the ability to take large numbers of essentially the waste material from widely used tests and ship them to labs where we can examine the genome sequence of the virus in those samples. And that's what we've done. And as was mentioned, we've done that in the UK at a really huge scale. So we've sequenced something like 150,000 samples, which is more than half of all of the ones that have been publicly shared around the world. And what that means is that's something like 7 or 8% of all cases of COVID-19 in the UK. And a lot of those are totally randomly chosen from around the country. And that means we have what we call genomic surveillance, or basically the ability to watch which different variants of the virus are circulating in which different parts of the country on a day-to-day and week-to-week basis. And so what we do is try to monitor essentially if new variants arise and what kinds of differences they have. And the new UK variant that was first announced a week or 10 days ago now had a couple of interesting properties about it. So as Frank mentioned, the virus changes all the time, and that's perfectly natural. But usually it happens quite slowly. And in those 30,000 letters of RNA, we see 1 or 2 new mutations appear at a time. In this new variant, we saw 23 all at once. So that's very unusual. It's essentially never been seen previously in the pandemic. And some of those 23 are in regions of the virus's genome that scientists had previously believed are probably important in terms of how it functions. So for example, 2 or 3 of them are in the region of the viral genome that encodes the bit of the so-called spike protein, which sticks onto human cells. And that means changes there, we believe, are more likely to have some kind of effect. So this combination of lots of mutations and some that are interesting was the first thing we noticed. And then what was sort of compounded on top of that was we began to see this particular variant spreading extremely quickly in the southeast of England and in London. And that's what's made it become sort of national and international interest, because it does seem to spread very quickly, and we believe indeed it spreads more quickly than the old previous version of the virus.
Thank you so much, Jeffrey. Judy, can you tell us more what actions have been taken by the UK scientists and experts since you came across this new variant of the virus?
Well, as you can imagine, there's a lot of research going on to try and measure what the impact of this virus is, to actually determine whether it really is spreading faster. And there's been quite a lot of work looking at the genomics, but also looking at the virus in the laboratory to try and work out what its properties are, whether it has the properties that would fit with something that was able to spread faster. And basically, there's been a lot of measuring of what this virus can do, trying to work out whether it's more virulent or not, and just basically sampling much more to try and sequence many more of the viruses to try and see what's happening. In terms of public health, the public health response is to what happens in the population. So it's to some extent agnostic of the variant, in the sense that if there is a lot of transmission going on, the question is not what it's due to, but just that it's happening, and therefore there's efforts made to increase the stringency of the tiers. For example, we moved in London from tier 3 to tier 4, but that was in response to the epidemiology. We still are measuring a lot of things with the virus to try and find out what is going on. What we do know is it is more transmissible, but we're still measuring a lot of other things to try and find out whether there are additional measures that need to be taken.
Thank you so much, Judy. Frank, based on the collaboration with the UK scientists and what we know so far, can we explain, are there any changes in the advice we are providing, or the precautionary measures and the interventions are still the same?
Yeah, that's right. And as Judy mentioned, I mean, research is really so important, and it really will help us to better understand what these variants really mean. But the important thing is really to keep in mind that even though the virus has changed, it's still SARS-CoV-2, and the existing measures and interventions still work and should be implemented. That surely hasn't changed. All of the basic public health and social measures we know work should need to be continued. Things that you have been doing over the last year: testing, isolating, caring for cases, contact tracing, quarantine of contacts of cases, but also really your individual protective measures like hand hygiene, physical distancing, indoor ventilation, very important now also during the holidays. If you're together with your family, make sure there's a window open or a breeze of fresh air coming into the space where you're gathering, and of course wearing a mask when necessary. And you know, it's not easy, and we all know that, especially after so many months and close to a year. But we really need to do it, especially now that we are in the holiday season. We all have to do it. We must do this together.
Thank you so much, Frank. Maybe one more question to explain to our viewers. Do we use the same tests to identify this new variant of the virus, or there have been changes in identification as well?
Yeah, that's right. That's a very good question. And generally speaking, I can say that the same tests can still be used. There is some news that part of one test is no longer functioning, but that particular test has several backup mechanisms to make sure that we can still detect the virus. So in principle, we are still able to detect the virus itself using molecular tests. And from the news that I've heard recently, even the antigen or rapid diagnostic tests are still working against this new variant as well.
Thank you. Thank you so much, Frank. Jeffrey, Judy, do you have anything to add from the field on this question?
No, I mean, I would endorse that. We haven't, my lab is still doing the same tests, and we're just being vigilant. But yeah, we're doing the same thing as we've always done. And also want to reinforce the messages on social distancing and continuing to use the same measures we've always used. The virus may be a little bit more transmissible, but you know, it's behaving exactly the same way. We need to use exactly the same measures as we've always done. That's our biggest weapon against this virus at the moment.
Thank you so much, Judy. Jeffrey, can you tell us, do you know how many people so far have been affected in the UK by this new variant? And do we know if this new variant is causing more severe disease than the regular one?
So in terms of how many people are affected, there are, I think, with the most recent data, just over 3,000 individuals who have the full genome sequence confirmed version of the variant. But of course, because we only sequence, even in the UK, a relatively small fraction of all cases, we know the true number is many, many times that. As Frank mentioned, one of the widely used tests in the UK has this little hiccup that happens by complete coincidence. The test works fine, but it looks slightly different in the new variant than the old. And that does mean we can track the numbers a bit more effectively because we don't have to do the genome sequencing on every single sample. Based on those numbers, there are certainly tens of thousands of cases of the new variant in the UK. It's still concentrated in the east, the southeast, and London, but it has been observed in almost all regions of the UK, at least at low levels. So I think it's important that throughout the country, people are as vigilant as possible with the kinds of precautions that Judy and Frank have been discussing. In terms of the severity of the disease, we don't really know yet. We've only recently discovered the new variant, of course, and so the next step is to try to build a sufficient number of instances where we can link patients who are affected with the new variant to whether they get sick enough to go to the hospital, whether they sadly eventually die. And we haven't quite done that yet. The early data suggests no difference between the new and the old variant. But again, we really do need to continue to gather more information on that question as we move forward.
Can we explain, Jeffrey, to our viewers, how does that work happens? How do you find the evidence if the variant is causing more severe disease or not? Which type of data are you using, or do you do the sample among the patients? How does it function?
Yeah, so one of the great aspects of how the Genome Sequencing Consortium has come together in the UK is that many different academic partners participate, and we essentially know nothing about the samples we process, just that a test was positive on some given date from some given place. And that means we can work very effectively while protecting the privacy of the individuals who are being tested. Once we make discoveries like this, we feed the information back to the 4 public health agencies within the UK for England, Wales, Scotland, and Northern Ireland. And those teams have the ability to link in their internal systems to deep records about essentially the medical history of different patients. And those are the teams that are currently doing the analysis on that personal information to try to understand, did people with the new variant, are they more likely to end up in the hospital, for example? It's a very careful analysis that needs to be done because, of course, those outcomes are correlated with lots of other factors that we all know about: age, obesity, other secondary factors. And so one has to be really careful to match the patients we look at with the new variant compared to those with the old variant to make sure that it's not some other confounding variable that might explain a potential signal.
Thank you so much, Jeffrey. We have thousands of viewers watching us at the moment, and several are asking, do we know if the new variant is causing new symptoms? Do we have any knowledge about it yet, or more research is needed?
Well, no, we, as Jeff said, we don't think at the moment there's any signal of any different disease. We think that at the moment we've seen nothing different in this virus compared to the variants that are already circulating. So at the moment, no evidence of anything like that. But ongoing studies, as Jeff mentioned, very carefully controlled studies so that we really collect good quality data. And that takes a little bit of time to do.
Thank you so much, Judy. A lot of people those days are also interested to know whether this new variant would affect a vaccine, a COVID-19 vaccine and in one of the vaccines has been already deployed in the UK recently. So is this new variant changing the vaccination plans?
No, the vaccination plans are going on as planned, as previously organized. We have no plans to change them. We have no evidence that this virus is behaving differently immunologically in the population. So we think that the vaccines will work just as well. And so we're rolling the vaccines out, and we're very carefully monitoring. But at the moment, there is absolutely no signal at all that this virus is behaving differently to the variants to other variants. We're not even seeing any signals, any early signals of reinfections at the moment, which is what you would see if there was something going on where the virus was not actually able to was not being controlled by antibody or immunity from previous infection. We haven't seen any signals of that yet either. So there's nothing to concern us. We're carrying on with the vaccine program, and we anticipate that it will work just as well.
Thank you for sharing all your knowledge so far.
Can I jump in, Alex?
Please go ahead, Frank.
Yeah. I just wanted to mention that because of course I fully agree with what Judy just mentioned. I just wanted to add that the scientists in both the UK and in South Africa are working very hard to get the live virus of these variants, and then they can do different kinds of tests in the laboratory to determine whether these viruses are still capable of being impacted by the vaccine. So the scientists are working on that. It's a really important assay that they're doing, a really important test, and we're very close to getting more information from those scientists. So that's something to really look out for.
Thank you so much, Frank, and Judy as well. And there's a lot of questions coming in and concerns whether we know if this new variant would affect, or does it affect children more than adults?
I've not seen the data. There are rumors that there is more transmission in children, but I don't know what data that is based on. This is probably work that Public Health England are doing. And so I've not seen anything published, but we just have to wait and see them. As again, they're doing the research. We're looking at the number of children being infected. But the problem, of course, with everything is that, just mixing more will make more cases happen. So you have to distinguish what is an effect of the virus spreading because it's more transmissible, or the virus spreading because more children are mixing. So, when children go back to school, more infections happen, and that's nothing to do with the viruses. That's to do with the fact that they're just contacting each other more frequently. And so dissecting out the effect of the virus from the effect of the social mixing is extremely hard. And so I think that needs very careful epidemiological investigation, and that's ongoing in the public health agencies in the UK.
Thank you so much, Judy. Frank, there's a lot. I mean, all of you, we've seen that this new variant has caused a lot of panic among public. So maybe, Frank, you can explain to our viewers how changes in the virus happen in general, and so that we can understand how this can impact our actions and the response. And is there a need for a panic and fear?
Yeah, it's an important question, and mutations always sound so scary and cause a lot of panic. But actually, for the viruses itself, it's quite normal. When viruses replicate or make copies of itself, they always change a little bit. Actually, they're quite sloppy, so they make a lot of errors, just like a typo when you write a letter. And these errors are called mutations. And the virus with a mutation is called a variant. So when we're talking about these variants in this discussion, it's a virus that has a mutation, and a mutation can be a change in a letter, but it can also be a removal of a letter, for example. Most of the time, these changes have very little or no impact on the virus properties, like infectiousness, transmission, and so on. But occasionally, they result in a variant that is better adapted, or what the scientists say, more fit to its environment compared to the original virus. And in that case, it can become the dominant virus in a specific environment. So there's a whole process of the virus changing, and the selection in its environment is what we call viral evolution. And it's a normal process, a natural process that all the viruses go through.
Thank you so much, Frank, for explaining this. And maybe I can go back to Jeffrey and Judy to summarize for our viewers, what do we know so far from the evidence you have gathered on the new variant, and where do we need more research, and what are the answers questions that we still need to answer?
So I think when the new variant was first announced by the Prime Minister, and his chief science advisor, Patrick Vallance, was speaking, he enumerated 3 questions, which I think are the 3 questions. Number 1, does it spread faster? And I think the answer I would give to that is very likely yes. We probably don't know absolutely for certain, but I think the rate of spread that we keep seeing in each new location the new variant spreads to is so high that it's very difficult to explain with any other possible story. There will also be some laboratory experiments that will probably ultimately absolutely confirm that one way or the other. Question number 2, which we've already talked about, is does it cause a more severe disease? And as Judy mentioned, so far, no evidence that it does. We need to keep building that monitoring data set in the coming weeks to answer that one way or the other as well. And question number 3, again, which we've already mentioned, is will vaccines work against the new variant? And here I agree with everything that was said previously. The thing I'd like to add is it's a really amazing achievement that scientists around the world during this pandemic have been sharing data so fast. we were just kind of getting our heads around what was happening 10 days ago, and now the data are being looked at throughout the world. The companies that make these vaccines already have access to the mutations that are in the new variant, and they can begin these experiments that Frank and Judy alluded to about whether their vaccines will work. That's just a rate of scientific progress that is truly amazing, and is, I think, a real benefit for all of humanity.
Thank you so much, Jeffrey. And as you mentioned, sharing information, sharing data, especially among scientists, have been crucial to identify actions that we all need to take in the response. And in that regard, Frank, maybe you can also tell our viewers what has been happening in South Africa and how we've been collaborating with colleagues and scientists there on the new variant in South Africa.
Yeah, I mean, South Africa, remember that I told you we have the Virus Evolution Working Group within the WHO, and that working group has experts in different kind of technical areas. Like some of them are very good at understanding how the virus behaves, some are very good at doing experiments related to animals, others are looking at, and so on and so on. So this Virus Evolution Working Group has different kind of experts, and some of the experts in the working group are also from South Africa, as well as from the UK. So very early on, we had already the opportunity to discuss these new variants and have an open and fair discussion among the different scientists with the different disciplines to understand what it really means, these kind of mutations. So when we first heard about the variant in South Africa, we actually already had a previous discussion about a similar virus that was detected among minks that had similar mutation or a similar change in the virus at position 501. So we were already primed for this change, and South Africa immediately called for a discussion among the scientists and experts of the working group to really understand what this new variant means. And as a result, we also had experts from the UK, for example, from the University of Edinburgh, Dr. Andrew Rambout. He was very helpful in working together with the colleagues in South Africa and really jointly investigate these different viruses. Of course, the initial studies are all based on sequence analysis and epidemiological observations. But as both Jeffrey and Judy mentioned, these live virus studies are extremely important in order to understand what these changes really mean. And we need to do those in the laboratory. They're ongoing. And for these kind of studies, the scientists are also working together and sharing viruses across different groups across the world, because some groups have a particular type of experiment that others don't have, or they have others have a virus with a particular change that others don't have. So all these things are being shared and jointly worked out to better understand what these mutations and changes all mean, and then put it in the context of epidemiology, clinical observations, and so on. So really looking at the whole package and trying to understand what this all really means in a comprehensive way.
Thank you so much, Frank. Before we close this conversation, I would like to ask you all, what are the next steps and what is the advice for people in the UK, and what is in the advice for people outside UK as well? Julie, would you like to start? Or Jeffrey, go ahead.
Sure. So I think the advice in the UK is to follow the guidance, so the new tier restrictions. It's important that people respect those as much as possible, and also follow the other kind of guidance we've talked about: usage of masks, keeping 2 meter distances, avoiding long congregation with other people inside. And I think that generally applies everywhere in the world. One thing we haven't talked explicitly about here is, because the UK sequences so much more than other countries, it's entirely possible that this new variant is actually also in other countries. And I think over the past few days, we've seen the first few examples of this, and I think we'll probably see more to come. So I think ideally, everyone should do their best to try to keep up with the precautions that we've all been trying to do for the past 12 months. And then I think within the coming weeks or maybe the next month, some of the experimental data that we've been talking about today will really also start to be available, and then we'll have some additional answers to questions about this new variant of the virus.
Thank you, Jeffrey. Any comment from you, Judy?
Yes, I would like to reiterate that exactly what Jeff said, that we should continue to follow the guidelines that we are already following. That's the way you deal with any infection, is to employ the standard methods that we're all using: social distancing, washing hands, wearing masks, is how we deal with any serious respiratory infection of this sort, and we should continue to do so, and to follow the guidance that is being established in each of our countries. And as Jeff said, I think that research will shed light on really how important this variant and other variants are, and we don't know which way it will go. It may be that these variants are less virulent. We don't know that yet, and that could also be an outcome. So I think we need to watch this space, to continue to do the research, both epidemiologically, the genomics, and also the laboratory backup, all the time, following the public health guidance while we wait to find out, what the impact of these new viruses is.
Thank you so much, Judy. And any final comments from you, Frank, on next steps and on how people can protect themselves?
Yes, it's interesting, and it appears that great minds think alike, because we didn't coordinate, and Jeff and Judy came up with something very similar that I wanted to say. I mean, obviously, we need to continue the sequencing work, not only producing the sequences, but also sharing them with the international community. We need to help the countries that do not yet have the capacities to do the sequence, and put in place a mechanism that they have that option as well. Research, we really need to do more research to truly understand what all these changes really mean. And a lot of it is in the works, but sometimes we just have to be patient, because science does take time, and these experiments, like growing viruses and doing experiments, they're not quick all the time. So really requires some patience if we want to have results that we can trust. So basically, stick to the science. Don't follow the headlines all the time, especially with these changes. They can be quite scary, the headlines, but really, be critical about the news that you receive from different media outlets. Always, double check with reliable sources, like, for example, the WHO website or your government website. And finally, I think it's still SARS-CoV-2. We need to continue all of the basic public health and social measures, just as Jeff and Judy just mentioned. They still work, and are just so essential to managing this pandemic, especially during the holidays. It's not always easy, but just do it as an individual, but also for the global community.
Thank you so much, Frank, and especially thanks to our guests, Judy and Jeff, for finding the time to join us today, and for doing all the important work, and for sharing all your work with my colleagues, but also with our viewers and the public globally. Just to mention that people from Gabon, Canada, Oman, Kenya, Ethiopia, Pakistan, Scotland, Nigeria, USA, India, Bangladesh, UK, Turkey, Sudan, Syria, Panama, Algeria, Spain, France, Netherlands, Brazil, Botswana, and many others have watched us today. Thank you, everyone. We will keep updating you on the new knowledge that we gain from our colleagues in the UK and around the world. Please follow our social media channels, our website, and follow the guidance from your national health authorities on how to stay safe from SARS-CoV-2, all variants of the virus, and as Frank mentioned, especially during this holiday season. Thank you very much. Until next time, be safe.